Diabetes is a disease that causes high levels of sugar to stay in the bloodstream. This high sugar level causes the destruction of vital blood vessels and can result in blindness, amputations, kidney failure, stroke, heart attack, and death. However, with proper treatment, most diabetics can live a relatively normal life. Type 1 diabetes is usually diagnosed in children and young adults and was previously known as juvenile diabetes. In type 1 diabetes, the body does not produce insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. Only 5 to 10% of people with diabetes have this form of the disease. Type 2 diabetes is much more common and is most often diagnosed in people over the age of 45. A tendency towards type 2 diabetes is genetic. However, the onset of the disease is often caused by poor diet and exercise. In Western cultures, where we tend to eat too much fatty and starchy foods, type 2 diabetes is widespread. However, in other cultures with less fat and starch in their diet, type 2 diabetes is rare. Today, there are around 24 million people in the United States with diabetes, and another 57 million have prediabetes, a term for those beginning to develop the disease. Diabetes-related deaths are around 250,000 per year in the United States, making it one of the top killers among all diseases. Minorities and those over the age of 60 are especially hard hit by this disease. Around $250 billion per year is spent on diabetic treatment and related medical costs. Fortunately, there are many treatments available for those diagnosed with diabetes. The most simple being to check for blood sugar levels often, to regularly see your doctor and optometrist to stay on top of potential complications, to eat a diet tailored to your condition, and to follow a regular exercise regimen. In some cases, medications will also be prescribed. Unfortunately, though these simple steps can prevent death and complications in the vast majority of patients, most patients do not follow this treatment plan. In its early stages, diabetes does not hurt or present with readily identifiable problems for those diagnosed. Some people may notice thirstiness, fatigue, or sores that do not heal, while others may notice no symptoms at all. Often, the best way to find out if you have diabetes is to get a blood test during your annual physical. Many diabetics avoid treatment or do not follow treatment guidelines until it is too late.